Okay, hi. So I did my project on evaluating Endeavour Health's response to the recent 2026 Canadian wildfire smoke event, practice setting, and chosen disaster. So for this presentation, I chose the Clark Primary Care Clinic, which is actually where I completed some of my clinical hours this semester. It's an outpatient primary care clinic in Chicago that's part of the Endeavour Health system. It provides preventative care, manages chronic conditions, treats acute illnesses, which makes it an important point of contact for patients during these kinds of public health disasters. So for the disaster that I'll be focusing on is the 2026 Canadian wildfire smoke event, which caused hazardous air quality across Chicago and many other cities. Since I live in Chicago, I experienced this firsthand and was able to see how the Clark and my preceptor specifically responded to the situation. So throughout this presentation, I'll use real-world examples to discuss how a primary care clinic can prepare for, can respond to, and recover from a public health emergency. So core principles of public health emergency preparedness. The first principle is planning. So the textbook defines planning as having an emergency response plan in place before a disaster happens. For a primary care clinic like the Clark, this could include developing a wildfire response plan, so providers know how to care for patients if the air quality becomes hazardous. Secondly is communication. So during events like these, it's important to keep both patients and the staff informed. Again, I saw this firsthand during my clinical rotation when the wildfires caused very poor air quality in Chicago. My preceptor was asking every patient, especially those with chronic respiratory illnesses, questions like how the smoke was affecting their symptoms, how she could support them, and then also educating them on ways to reduce their exposure, like staying indoors or wearing a mask. And then the next principle is coordination, which involves working with other healthcare providers, and that can be within the clinic, within the larger health system, and then also working with public health agencies to make sure patients receive consistent care and communication. And then next is workforce readiness, which means making sure providers are prepared to recognize and care for patients who may be at higher risk, such as those with asthma, COPD, or other chronic lung diseases. And then lastly is resource allocation. This focuses on making sure patients continue to have access to care and the resources they need. So in this situation, that can include making sure patients are still able to attend their appointments, offering telehealth visits whenever appropriate, and then ensuring access to medications, and then again having the adequate PPE like N95 masks available. Okay, so the first phase of emergency management is mitigation, which mostly focuses on reducing the impact of the disaster before it happens. So according to the Environmental Protective Agency, one of the most important mitigation strategies is monitoring the Air Quality Index, or AQI, and then the monitor wildfire smoke forecasts. So this is important so providers know when the air quality is becoming hazardous, so that they can inform their patients. The EPA also recommends identifying patients who are at high risk, again, like those with asthma and COPD, before a smoke event occurs. Another important goal of mitigation is reducing smoke exposure. So that could be encouraging patients to stay indoors when the air quality is poor, creating cleaner indoor air spaces, and that could be with the use of these HEPA filters or clean air space filters. And then having, again, a wildfire smoke response plan in place before an emergency response occurs. Next is preparedness, which focuses on making sure the clinic is ready before a wildfire smoke event occurs. Staff training is super important, and this could include required online modules in order to train the staff to best treat their patients during these events. Again, making sure supplies like N95 masks are available, and then identifying any patients who are at higher risk. Communication, again, super important. With the clerk specifically, they could use MyChart, or they could actually call patients directly, letting them know that the air quality is poor, and then remind them to follow their asthma or COPD action plans. Providers can also encourage patients to refill their medications ahead of time so they don't have to go out in the poor air quality, and so that they're prepared. Finally, the clinic should review its emergency response plan and coordinate with the local public health agencies. Okay, the third phase is response, which focuses on what happens during the actual event. So during the wildfire smoke event that happened recently, providers at the Clark assessed how the poor air quality was affecting patients. This included reviewing inhaler use and asthma action plans, discussing ways to limit smoke exposure, and deciding whether patients could manage their symptoms at home, or if they needed higher level of care. Again, I was able to see this during my clinical rotation, which showed me how important primary care can be during these types of events. And then lastly, the final phase is recovery, which focuses on getting back to normal after the event. So at the Clark, this could include following up with patients whose symptoms worsened and returning to routine care once the air quality improves. The clinic can also look at what worked and what could be improved, and use that information to better prepare for future wildfire smoke events. Okay, so primary care clinics, just in general, have a very important role in protecting the overall health of the community during these events. This includes maintaining continuity of care, helping patients manage their chronic conditions, and offering options like telehealth when air quality makes it difficult to come into the clinic. Equity is also really important because wildfire smoke doesn't affect everyone equally. According to the CDC, certain groups are at higher risk, including, as we know, those patients with chronic respiratory illnesses like asthma and COPD, but it also includes older adults, children, low-income patients as well, and other vulnerable populations. So as we look into the future, wildfire smoke events are becoming more common, unfortunately, and also can occur alongside things like extreme heat. So because of this, primary care clinics need to continue adapting their emergency plans to prepare for these changing public health threats. And then to wrap everything up, I think the Clark demonstrated a lot of strengths during this event. One of the biggest was communications. Again, I saw this firsthand as providers consistently checked in with their patients, answering questions, and providing education. And then being part of a larger health system like Endeavor Health, I think, is also a strength because it helps support that continuity of care, and gives patients access to more resources as well. At the same time, I think there were some opportunities for improvement, and that includes developing a formal wildfire smoke response protocol, providing more disaster-specific training for providers, specifically outpatient providers, and expanding outreach to high-risk patients could help the clinic be even more prepared for future smoke events. But overall, I think the Clark handled the situation well. But as these wildfire smoke events and other climate-related public health emergencies become more common, it's important to continue to strengthen our emergency preparedness to help both the patients and the community overall. And then these were my resources for this project. Thank you.